It's Etch back with another health highlight from Michigan Primary Care Partners and Y102. Now this week we're going to change focus a little bit. I know in previous weeks we've been talking about specific ailments, certain illnesses that you may have coming up in your life or people that you know, and how Michigan Primary Care Partners can help you get through those or kind of circumnavigate that whole process of getting diagnosed and getting on the road to relief, right? Well, this week we're going to talk a little bit about your primary care physician, because prevention is key. Now, as a cancer survivor, I can tell you this with certainty that that's very important. Getting tested if something doesn't feel right, making sure that, because you know your body, right? You know your insides more than anybody else. And you've got to be the first advocate for yourself to go out there and say, hey, I think something's wrong. There's just something that doesn't feel right. And you know what? If you're wrong, that's okay, right? That's the beauty about having your own choice of what you do. Now, you also have your own choice when it comes to internal and family medicine and who your doctor is. Now, this last January, you may have switched insurance providers. Maybe you're just doing that now. Maybe you just had a job loss and you're starting with somebody else due to this whole, COVID-19 thing. And due to your change of situation, you've had to change your insurance. Well, did you know that sometimes your insurance provider might not know who your primary care physician is? So they just pick one for you. And then all of a sudden you get this bill and you're like, wait a minute, that's crazy. Like insurance didn't cover anything. Yeah, well, it's because it was billed a certain way. You got to let them know who your primary care physician is. So it's very important finding out what's happening with the inside of you. And that's what we want to make sure that you know with Michigan Primary Care Partners.
So family practice has a little bit wider range of care that is provided. They can see women, they can see children, and they can provide a basic level of care. But some patients have multiple severe medical illnesses. If they have 4 or 5 medical illnesses, for example, the patient has coronary artery disease, they are a diabetic, they have hypertension, and on top of that they have some renal insufficiencies. Those patients are probably better to be seen by the internal medicine practice versus the family practice. If you're a young healthy female, you're 45 years old, you have no medical illnesses, your labs are perfect, it's great to be seen by a family practitioner.